Wait a second. Are you telling me that I could have reflux disease, that my throat clearing and my froggy voice and my, difficulty swallowing, my cough, my chronic cough could be the result of reflux? You mean acid coming up from my stomach into my throat? Are you telling me that that's the case? That's right. I mean, it's possible that you have been taking medications incorrectly or not long enough. You're not doing behavior modifications. Reflux disease is very common, especially as you get older. So if you could take medications correctly and follow behavior modifications to the letter for a long enough period of time, you may find that an over-the-counter treatment may make the difference. Would you like to know a little bit more? Come on. Bring it, brother. You tell me how I can use over-the-counter remedies, behavior changes to make these long-term symptoms, the throat clearing, the cough, whatnot, go away. I'd like to know. I'll bring it. No worries. It's completely normal to be confused about this treatment of LPR reflux, acid reflux, getting into your throat, burning your throat, and causing you to have these symptoms. For one thing, it's often silent, so you don't even notice you're having it. How could it be silent? Happens sometimes at night when you're sleeping, or you just may not be aware, which is crazy, but true. It's far more common than you realize. Number two, you can take an over-the-counter medication, which you may have tried. There's a variety of medications you could try. You should seek attention from your physician so your physician can guide you in your particular situation. I'm going to talk about some over-the-counter opportunities you could try. They're called proton pump inhibitors. Google it. Prilosec, omeprazole, Nexium, Protonix. There's many others. You need to take this medication and then half an hour to an hour later, eat a meal that has protein and or fat. Why? A proton pump is an acid pump. The medicine needs to be absorbed into your bloodstream, flowing through your bloodstream, and then you need to eat a meal that activates your proton pumps, and then the medication will block them. So if you take them before you go to sleep at night and you don't eat anything a half an hour later, you're probably blocking 5% of your proton pumps, some small percentage, 1%, I don't know. But if you take it a half an hour to an hour before dinner, and then you eat an American dinner, which usually has protein and or fat, it'll really work. Some people take it a half an hour to an hour before a meal in the morning and the evening, twice a day. It's important that you do this for a long enough period of time to see that you're getting results. What's a long enough period of time? 3 months would be ideal. A 3-month trial of a proton pump inhibitor is fantastic. Of course, do this under the guidance of your physician. Does that help? That is so helpful. Why didn't my doctor tell me about that? Well, that's a good question. Why didn't my doctor tell me? And then number two, I don't know if I took it and then had something protein a half an hour to an hour later. And I'm certainly not sure if I took it for 3 months. Are you saying I have to do the behavior modifications in addition to taking that medication? Taking the medication is not enough? Great questions all. Physicians nowadays are often employees. If you can find a clinic that's a family-owned clinic run by that physician, they may have the latitude to spend more time with you. But in fact, you can't defy the laws of physics. So if you're an employee of a big organization, that organization's going to take a cut of what you make. In order for you to continue to make what you made before, you have to see like twice as many patients. You have to pay your boss first, and then whatever you make helps to pay your income. So the physicians are going from 30-minute appointments down to 8-minute appointments, and we've all felt that, unfortunately. Not necessarily their fault. They're trying to do what they can. They can't defy the laws of physics. Number two, a lot of them may not know you take that proton pump inhibitor, that Protonix, Prilosec, and omeprazole. 30 to 60 minutes later, take something protein in order to maximally activate the acid pumps. And number three, it's hard to do the behavior modifications. No one likes to hear that. No chocolate, no caffeine, no tobacco, no alcohol, nothing with bubbles in it, nothing spicy, nothing with fat, no chocolate, no tomato-based food like lasagna and so on and so forth, nothing spicy, nothing acidic. Yeah, that kind of sucks. Do you think doctors like to tell you not to do that? No. Instead, they make these goofy handouts and they hand them to you. So you can then watch the video at the end of the handout and you hear it from this dude because it's easier that way. Does that answer your questions? Yes, that does. Thank you very much. And might I say, there's something strangely attractive about you. I know. I think it's the glasses. Modern Nose Clinic. We know your nose.